I'd now like to welcome the Union for International Cancer Control CEO, Cary Adams, who's joined me, as you can see, here in the studio. UICC's headquarters are actually based here in Geneva, and it's obviously wonderful to have you in the studio with me today. Now, Cary Adams is going to be taking over the next session. This is focusing on UICC's Young Leaders programme. And Cary, I hand it over to you.
Thank you very much, Hannah, and welcome everyone. The UIC's Young Leaders programme has been supporting emerging cancer professionals to become successful leaders in global cancer control since 2013. The vision of the UIC's then President Mary Gospodarovich, the programme recognises that in order to address the complex challenges of cancer control, it was critical to actively nurture a diverse leadership pool for tomorrow. Since then, 45 professionals from diverse disciplines across the cancer control continuum have completed the programme. They are now part of the Young Leaders Alumni Network, a community of change makers that continue to drive impact, disrupt and change the course of cancer at national, regional and global levels. Many are with us today. The programme has been made possible thanks to the support from many organisations over the years, from the Canadian Cancer Society to Cancer Council Australia and Roche. A great number of young leaders have gone on to take up critical roles within governments, multilateral institutions and international organisations, including 2 who are currently members of the UIC board. Those investments have been well placed. It is therefore with great pleasure that I present you today the latest cohort of young leaders, an inspiring group of professionals that, over the coming year, will be supported by UICC to access the networks, knowledge and platforms to help them fulfil their ambitions and become established leaders in cancer control. And they are Anna, General Surgical Oncology Fellow at the University of Toronto, who aims to use her research experience to reduce global inequities in cancer to care, access to care and surgical care. Arnaud, Assistant Professor in Drug Development Department at Gustave Roussy Cancer Centre, who works to improve access to innovative medicines both nationally and at the global level. Asma, Tobacco Control Specialist at King Hussein Cancer Centre, whose ambition is to be a powerful advocate and educator in the field of tobacco control and healthy lifestyles. Chemtai, Assistant Professor, Obstetrics and Gynecology at the University of North Carolina, who leverages her expertise in support of cervical cancer elimination efforts globally. Diego, Head of the Radiation Oncology Department at the National Cancer Institute in Paraguay, whose professional ambition is to expand access to radiotherapy in this country and the wider region. Enrique, Geriatric Oncologist at the National Institute of Health Sciences and Nutrition in Mexico, who has a passion to improve cancer care for older adults and address inequities in this field. Freddie, Assistant Professor of Surgical Oncology at the University of Abomi Calavi in Benin, who strives to implement strategies for the reduction of breast cancer mortality in sub-Saharan Africa. Melissa, Member of the Society for Cancer Advocacy and Awareness in Kuching, Malaysia, whose interest lies in the delivery of support and care services for rural populations. Tolotlo, Head of Oncology at Princess Marina Hospital in Botswana, who has the ambition to support policies to expand access and decentralise cancer care in that country. Venus, Programme Manager at Department of NCDs at the Ministry of Health in Zimbabwe, and a passionate advocate for better access to medicines and stronger health systems. Without doubt, this is a fantastic group of aspiring young professionals. Congratulations from UICC's board and the UICC family. The future of cancer control is in good hands. And on that note, I hand back to you, Hannah.
Thank you very, very much to Dr. Cary Adams. Thank you for introducing us to what is clearly a really impressive group of people. We are going to now move on to addressing the COVID-19 vaccines and what we've learned from it when it comes to cancer control.